Hello, everyone. This is Dr. Nadal,
And Dr. Ludenia.
and we are here again for an episode of What the Health, the Doctor's Chat. Today, we're going to go over what we like to call foundations of health, right? Just some other doctors might call them like basic treatment guidelines. And these are some of the things that we like to put in place and talk about with all of our patients. Being the foundations of health, these branch into a lot of different areas of life. Some of them might sound more simple and straightforward, but it's good to talk about them and remind ourselves of them, right? And so just from the start, I mean, we think about food, right? Like what we put in our body, right?
Yes.
Okay. So nutrient dense foods, eating food with the highest value that you can get. I mean, there's so much talk about different diets, keto, paleo. There's a new one where they're blending keto and paleo. I think I forget who's doing it, but either way, there's a lot of different diets out there. It's not a one size fits all. Just really keeping in mind, depending on where you're at in life and what you're trying to achieve, just focusing on which macronutrients you need and micronutrients. And from there, we can just think about proteins, carbs to fats, healthy fats, and getting the right ratios in. There's different nutritionists and apps out there, even us. So it can sound complicated and intimidating, but it's really not that bad. It's really just talking to someone who's willing to listen and coordinate time to put together a good nutrition program for you if you need that support, right?
That's right.
Yeah. Any fun diets or fads that you follow lately or enjoy?
Yeah, not really any that I'm following at the moment. I kind of like to try a lot of different ones
Hmm.
during different seasons too.
Yeah. Season specific.
Yeah.
Out here in Portland is kind of nice because you can eat locally based on the season, like different foods and veggies,
Yeah.
right?
Yeah.
Yeah. And then some people are still doing it, but a lot of our patients benefited from the Whole 30 as kind of a reset, you know. So just some food for thought there, right? So next, let's talk about movement. Give me some information on movement. That's good to remember.
Yeah. This is one of the big foundations of health, right? We need to move our bodies for various reasons to get our lymph flowing, our circulation moving. We need all of this for all of our organs, um, as well as kind of our mental health.
Definitely.
Yeah.
Mental health, hormone optimization, and even once we get a little older, there's a lot of research on resistance training being great to helping prevent some of the things associated with osteoporosis. It's actually good for your muscles and good for your bones,
Mhm.
right? And 30 to 60 minutes a day can look like different things, whether you want to go to a gym, some personal training, high intensity interval, even some cardio. I think it's best to mix it up and make sure that you're having fun with it somehow. Because the best exercise routine is one that you're actually going to do and stick with, right?
Mhm.
Yeah.
That's right. And going back to the strength training, I was reading an article the other day about women and kind of trying to, do some of the prevention for osteoporosis. And they were talking about that even before the age of 35, it's very important for women to be doing strength training to build up the muscles and help with the bone strength.
That's
So
huge.
it's never too early, really,
Yeah,
to start.
absolutely. Absolutely. Well, and then what about getting outdoors? It's getting rainy out here in Portland, but it's still super important, right?
Yes.
Yeah.
Mhm. I mean, the big reason to get outside one is for the fresh air, right?
Hmm.
And what that does. And then also we think of the sunshine and the vitamin D. Um, Unfortunately, here in Portland, yeah, that's um, the sunshine's going away right now.
But something, I mean, even still getting out there, whatever sun is coming into those gray clouds, like we're still getting the benefits of that full spectrum light that's coming through somehow.
Absolutely.
Right? Yeah. Yeah. And then it's something we could always do out here in Portland is the whole forest bathing. So Japanese word for it is Shinrin-yoku. I don't know if I'm pronouncing it right, but there's a lot of research supporting getting out in nature in the woods like this and serious objective measures from like heart rate variability, improved breathing, blood circulation. Like these are all measures that have been tested in different studies. So
Mhm.
it doesn't just feel good, it's not just pretty, but it's actually helping your body in real physiological ways.
And can
Right.
help reduce blood pressure as well.
Yes,
hmm
absolutely.
Yeah, and it can even be turned into a little bit of a meditation. If you go out into the forest and you kind of get all your senses on board, right? Like the smells, the sounds, the sight.
Mhm.
Um, yeah, so there's a lot of benefit, and it doesn't even need to be a big forest. It can just be a cluster of trees or even in the park.
Yeah. I mean, we have a forest as a park out here in Forest Park, so
Forest
we're
park.
kind of spoiled. Yeah. And then even ocean walking, right?
Mhm.
If you have a coast near you or even just a larger body of water, there's something about it, just the stillness of water and well, even waves, but
Yeah.
it can really engage some of the parasympathetics and help to reset some of the nervous system tone. So it's good.
Mhm.
And then even thinking about like when we travel, like I don't know about you, but if I go overseas, even across the country, sometimes like just being barefoot, like kind of some call it earthing or grounding and walking barefoot on the soil there,
Yeah.
helping a little bit with jet lag and to kind of reset things.
Yeah. And there is that whole ion exchange that happens too from the ocean water, exchanging the negative and positive ions
Yeah,
that has been contributed to the grounding and the kind of relaxation and big parasympathetic shift that happens.
that's awesome.
Mhm.
Awesome. And then what about water, the water that we drink? What do you think about that?
Yes, that's also really important because we're mostly made up of water.
Right. Right.
And so we want to make sure that we have some clean sources of water.
hmm
Um,
There's a lot of good filters out there now.
mhm.
Yeah. And I mean, even the idea of drinking like half your body weight in water, right? And that sounds like a lot. And I guess it is kind of a lot, but let's say you weigh 150 pounds, you know, look at it as like 75 ounces of water in that way. That's the calculation
Yeah, and throughout the whole day.
throughout the whole day, not in one shot. Yeah.
Yeah.
Yeah. I've seen some friends with those big bottles that'll say like you're almost there, keep going, that just measure the times of day when you're
With some
drinking water.
encouragement.
Yeah, it's funny. And there's some cases, like more extreme conditions like congestive heart failure. Like there's some circumstances where you need to be more mindful and as far as water intake and the possibility of retention and all that, but that's another conversation. These are more general recommendations. Obviously, patient to patient, it might be a little bit different. So
hmm
just keeping
hmm
that in mind.
Yeah. And uh, with the water intake, there's a lot of information out there that talks about how when you actually sense that you're thirsty, you're already a little bit dehydrated.
That's right. There's like
Mhm.
receptors in the back. Like, yeah, if you start drinking water, like, oh, so refreshing, like you feel like you needed it that bad, that means that you've probably been dehydrated for a lot longer than you expect.
Mhm.
Yeah.
Yeah. And being a little bit dehydrated, you can feel tired, a little bit groggy.
Mhm.
Your brain just isn't thinking as sharply.
It's true.
So
And I like to
that's
put some trace minerals in my water throughout the day as well. There's different brands that do that, and it could just be in drop forms, maybe a little powder, at least once or twice throughout the day. Because besides water itself, some of the lost electrolytes and nutrients that we don't have as much in the foods that we get from the soil that's sometimes depleted. It's nice to kind of support that
hmm
in that way.
yeah.
Yeah. And then we briefly mentioned breath work or breathing, but I mean, let's talk about it a little bit more.
hmm
Deep belly breaths. What does that do for us?
Well, that activates our parasympathetic system. It kind of helps us expand our diaphragm.
Mhm.
And so when we focus on our breath coming in through our nose, down, and then you focus on it coming down into your belly. So you kind of feel your belly go out and then go back in with each breath. It encourages us to take those deeper breaths. And so
Mhm.
we're not doing kind of the shallow breathing. And then the deep breathing, um, getting the parasympathetic system on board. And then it's also helping with oxygen perfusion and circulation throughout our body, giving the little red blood cells more oxygen.
Yeah, they need it. They want it.
Mhm.
And yeah, and there's just, I feel like in society right now with as much stress and chaos, it's kind of a negative feedback loop. Like the anxiety makes you breathe more shallowly, and then breathing shallow, it's kind of a low grade hyperventilation that leads to more anxiety and more CO2 retention. So it's,
Exactly.
yeah. So deep breathing, meditation besides sleep, but some deep breathing can be, think of it as like an exercise for the vagus nerve and resetting parasympathetic tone.
Mhm.
It's easy. Everyone can do it. Everyone should be doing it, breathing at least. But the deep breaths, there's something to think about and incorporate. Then there's so many, there's like Mind Body app and all these different things to kind of guide you through it if you need that support. Right?
Yes. Mhm.
Yeah.
And then the best way to get some deep breaths in that we do a lot around here
Hmm.
is,
What? Like the fourfold breath or qigong or
well, we do all that.
yeah.
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 But
Oh, laughter, laughter. Yeah. Laughing is some of the best medicine. So absolutely. Yeah. Yeah.
mhm.
We do a lot of that around here. Laughter, you're taking deep breaths, but it's just freeing a lot of those kind of narratives and processes that you might get caught into. So yeah. Yes, we are prescribing laughter.
They also have isn't it called laughter yoga?
Yeah.
I think.
Yeah.
And it's kind of fun. You just one person starts laughing and then
It's
it kind of just
contagious.
spreads through the whole group. Yeah.
Yeah. It's good to do it simultaneously, like maybe laughter and baby goat yoga.
Oh,
That'd be awesome.
that would be
Yeah.
the combo of the
Yeah.
two.
As long as it doesn't scare the baby goats. Yeah. Well, also, rest, sleep hygiene should be straightforward, but I mean, with the cell phones and computers, there's so much damaging light that we're getting from it. There's got to be a kind of a call to arms and reminding people of how important just good sleep hygiene is. Because even if
Mhm.
you're really tired, you lay down and you're just watching TV and just looking at your phone, all of the light, all of the fake light and blue light that's coming through all those screens, it's messing with your brain's ability to actually set off the timing and release of the right amounts of melatonin and just to kind of shift all the different hormone pathways in your body that are actually going to be beneficial while you sleep to rest and restore. So just really big emphasis on lighting, right?
Mhm.
But
Yeah.
also like ambient temperature. It's actually better to be a little bit in a cooler space. Um, yeah. Anything else you think important to bring up?
Yeah. I think no cell phones
Mm-hmm.
in the bedroom is a big one, or if you can turn off the Wi-Fi so
Hmm.
you don't have any of that. Um,
Or at least airplane mode. Right.
yeah,
Yeah.
yeah. Yeah, and then remembering too that it's about kind of setting that routine. And so our bodies do love routine. And so if you can, start your bedtime routine at least an hour before bed, even if you're able to take a warm shower or an Epsom salt bath to kind of help you start to relax. And then your body over time, it may not help the first night or the first couple nights, but kind of over time your body will get into that rhythm of, okay, now it is time to relax, it's time to go to bed, wind down. And so that can really be really impactful, um,
Yeah.
to fall asleep and get in that pattern.
Awesome. Sacred sleep. It's
Yeah.
important. And then what's next? What about like moving lymph?
Mhm. Yeah, so this one's really important, as
Hmm.
well as are all of them, but
Hmm.
I feel like I'm saying that on each one. But lymph is so important because it moves, it's part of our immune system, right?
Yeah.
It's what's moving kind of the toxins in our body and helping everything circulate within. So along with the gentle movement, that's one of the easiest ways. Our muscles contract and that's what moves the blood as well as the lymph throughout our body. But there's also dry skin brushing.
That's right. That's right.
Yeah, and that's just a little brush with some pretty soft bristles. And then you just ever so lightly brush your skin, and you always want to brush up towards your heart, um, so that it can move up your body and then out
Yeah.
through the portal there.
And it's a lot lighter than you expect.
Yes.
Yeah. Have you ever gotten a lymph massage? It's like they're barely, it's very, very light contact. Yeah.
Yeah, yeah. It feels like almost like a feather,
Yeah.
kind of.
Yeah. Pretty much.
Yeah, but there are a lot of like massage therapists and that too that do just specifically lymph massage
Hmm.
if people are looking to do that, if they don't want to do it at home
Yeah.
or want a little more in depth. There's a lot of training too on how to do different brushing patterns or stroking patterns. Um,
Excellent. And then even things like castor oil packs, right?
mhm.
Yeah. Could be over the liver, over the abdomen. The oil is actually going in there and helping with inflammation and eventually improving some of that lymph flow and circulation in the area. I mean, it's also good for like some pain and inflammation in joints too,
Mhm.
castor oil.
Yeah, castor oil packs are amazing.
Yeah.
We do
Yeah.
a lot for just a little oil.
Yeah. A little goes a long way. It can be messy. Yeah.
Yeah.
But it's worth it. And then what about things like immunity and just resiliency,
Hmm.
right?
Yeah, I think a lot of hydrotherapy, and I know there's kind of been a big
A return.
return. Yeah, especially was it
Oh, like Wim Hof. And
yeah, with his cold water plunges
yeah,
and breathing and all that. So
it's huge. It's huge. It's like a shock to the system, but it's a good shock. It's like it's more of a cardiovascular like contraction and expansion and just really getting things going. And it doesn't have to be diving into a sub-zero lake or climbing a mountain with barely any clothes on and being freezing, even though that's great for some people and very useful. There was some studies and research like showing how he was actually changing his immune cells, and it was
yeah.
pretty impressive. But for us common folks, we can always just even ending our showers with 30 to 45 seconds of cold,
Yep.
right?
Yeah.
Yeah.
And it's doing multiple things. If you take a warm shower or you're warm, um, kind of our blood vessels dilate and that happens. And then when we introduce the cold, whether it's a cold towel or just the cold 30 seconds at the end, kind of our blood vessels constrict. And what happens is our blood is pumped to our internal organs because those are kind of the big the big players when something happens, our body's like, oh, we need to take care of our most vital organs, right?
Hmm.
And so that pushes a lot of blood into those organs, which is very nourishing for
Yeah.
them.
Yeah.
And then it also increases the number of white blood cells, which is helpful for our immune system. It helps with detoxing and excreting toxins. So
Yeah.
it's just as simple as turning that dial
Yeah.
for 30 seconds.
Amazing. And then, we talked about laughter and we talked about movement, but really just the emphasis on playing and having fun. Maybe easier said than done. I mean, we know stress kills, right? It's not just in our heads, right? It's cortisol, it's changing our hormones, it's weakening our immune system, stress, right?
Mhm.
So finding something that's meaningful and fun and enjoyable, whether it's coming together with community and friends, or even just spending a little more time at dinner, telling stories, whatever that looks like,
Yep.
right? Or finding something that is fun for you to do, whether it's a simple art project, painting, poetry, reading, music. There's so much. And it's easy to say I don't have time for it. And yes, there's different lifestyles and sometimes, with family and work, life can be crazy, it can be hectic, but even 5, 10, 15 minutes a day, anything, something that's going to bring out some of that joy, let's call it like childlike playtime, it's needed.
Mm-hmm.
It really is needed. So I
Mm-hmm.
recommend it a lot. Anything else on that one?
Uh, I just think this is one of the most important ones.
Yeah, absolutely. I I
For
love I love making music personally.
hmm
It's a great outlet, good release. I feel like I think better, feel better after making music.
hmm
Yeah.
yeah. I kind of like to change it up sometimes. sometimes I'm like, gosh, what do I like to do for fun? And it can be kind of overwhelming of like, I don't know. I'll just go back to my, working routine.
Mhm.
And so turning it into a little game of like, okay, I'm going to try something maybe new that I haven't tried before and see if that's fun, see if I like that.
Yeah, the brain and body needs it. It likes it.
Mhm.
All right, guys. Well, I hope that was fun and useful, right?
Yeah.
This is back at What the Health, the doctor's chat. We try and bring you an episode weekly. So
Mhm.
stay tuned. There's always more to come. It's good connecting with the community and bringing awareness back to some of the more important things that can be done day to day.
Yeah. And the nice thing with these is the majority of them are free,
Yes.
right?
Yeah, it's true.
which which is great because that's our foundation of health and you don't, have to pay anything for that. So
That's amazing.
that's wonderful. And then it can be a little overwhelming, like, oh my gosh, look at all these things. But if you just start incorporating, pick one, the one that you resonate with the most, and just start incorporating it every day for a week. And then the next week, add another one or,
Yeah, I like that.
pace. And then pretty soon you have all the foundations covered.
That's great. That's a good recommendation.
Mhm.
Yeah. Well, guys, thanks again for tuning in. We hope to see you next time. Once again, over here at Nature Cures Clinic in Portland, Oregon, this is Dr. Nadal.
And Dr. Ludenia.
All right. You take care. Until next time.